On behalf of Genentech, we would like to thank Black Health Matters to allow us to share the time and the podium today and talk about all things asthma, which is very important. So it is my distinct pleasure to introduce our esteemed panel. We have Dr. Audra Johnson and Dr. Randy Hawkins. I'll tell you a little bit about both of them, and I wish I had all day to talk about how amazing they are, but I only have a few seconds. So Dr. Audra Johnson is a medical science liaison at Genentech, focuses on the area of rheumatology, immunology, and gastroenterology. She most recently received a global recognition for her efforts as a part of the team that helped to provide medication to patients with COVID-19 during the height of the pandemic. And before starting her career in the pharmaceutical industry, Dr. Johnson did her postdoctoral scholarship, was a postdoctoral scholar at UC San Francisco, and also served as an instructor at SF State for undergraduate and graduate students. And she earned her PhD in chemical biology, stem cell focused therapeutic development at the Scripps Research Institute. So she's really, really smart. And yeah, don't be fooled. She's really smart. And then Dr. Hawkins has been in private practice in Inglewood, California. Let's give a shout out to Inglewood. So he's been there since 1986. He has held leadership positions in several arenas over the last 30 years. And he has been on the board of several volunteer organizations, including Sickle Disease Research Foundation and the American Lung Association. He's an active member of the Golden State Medical Association of California and the National Medical Association. And he has held most offices in the Charles Drew Medical Society, including president and treasurer for the last 4 years. He is a board certified in internal medicine and pulmonary and critical care medicine and member of the Medical Board of California since 2015. I also want to mention that he is a member of the FDA Cellular Tissue and Gene Therapy Advisory Committee, and the Governor Gavin Newsom appointed him to the Physician Assistant Board in August of 2020. I know you wanted me to, I know you want to keep it short, but I just got 2 more things. Dr. Hawkins is exceptional in his comprehensive medical care, and he is an excellent mentor and teacher to physicians in training and the young generation of physicians. So give it up for Dr. Johnson, Dr. Hawkins.
Well, hello, everyone. So thank you. Thank you very much, Dr. Malik. As she said, my name is Dr. Johnson, Audra, and it is my privilege and pleasure to be here with you all today. I love seeing all your faces in the audience and to do my little part to hopefully help facilitate a conversation and up-level our knowledge. With that, I would just like to let you know, so we're going to talk about allergy today. We're going to talk about what are the signs and symptoms and what patients can do. We want to empower you. We want to make sure that you know the steps that you can take to help manage your asthma. And with that, I wanted to start with a little fact. I was so surprised when I found this out. I'm not sure if many of you know this, but there is a very, very, very famous, at least in my heart, African-American woman who had an asthma diagnosis. And that woman was Jackie Joyner Kersee. And I don't know if you knew this, but yes, she won 3 gold medals between 1988 and 1992 and set 5 world records and was designated I know this sounds very scientific, designated the athlete of the century, all while struggling with asthma. So I feel like she's proof that so many things are possible. And with that, I will start with you, Dr. Hawkins. Can you please tell us a little about yourself and your community that you serve?
Well, thank you very much. Actually, I asked for the short version, but Nina gave you the long version. So, Dr. Randy Hawkins, I'm a physician in private practice in Inglewood, and I'm an internist taking care of adults, and also a lung specialist. So I take care of asthma and common symptoms of respiratory problems like shortness of breath, cough, and sputum. In addition to taking care of patients for 37 years, what I really want folks to know is that I believe in service and giving back. So I'm on an FDA advisory committee I volunteer and mentor students at Charles U University and residents in the same capacity. I'm on the PA board. Most recently, I was elected as president of the Medical Board of California, whose mission is to support patients. We also discipline doctors and licensed doctors. So I've been given the opportunity to serve for many years and continue to do that now. Our goal really is to talk about asthma and really empower folks to take charge of their health. I'll stop there.
Yeah, well, I just want to say thank you so much for your service, and I'm glad to know that you're in the room. Very much so. So with that, let's dive in. So what is asthma? What are the symptoms and signs? How do we recognize this?
So in this room, there are several people who have asthma or have family members that have asthma just because it's such a common disease and disorder. I'm going to start with an analogy. If you think about a tree, the tree trunk can be analyzed as your windpipe. And there's a series of branches that conduct the air into the lungs and from there into the blood. So the lungs are a respiratory system. You have two lungs, and their job is to get oxygen into the blood to go to the tissues so the body can do its work, and to get rid of carbon dioxide, which is a breakdown product of metabolism. So asthma is a condition where those tubes, those branches of the tree, get narrowed. They're narrowed from inflammation, which causes, the narrowing causes cough, sometimes mucus production, often chest pain, shortness of breath, sometimes at rest, sometimes on exertion. So this conduction system gets narrowed and results in those symptoms of cough, chest pain, chest pressure, shortness of breath. You may make mucus or you may not make mucus. When someone has what's called an exacerbation of asthma, that means there's a flare-up of those sorts of things. So they're coughing more, they're more short of breath, they're more chest tightness, they can't do their work, they may be able to go to school. And that's what asthma is. And I mentioned what an exacerbation is, which is what we want to avoid, so folks can do the things they need to do. Grow in school, be productive folks in work, and contribute to society.
Definitely. And so transitioning into that, can you talk to us a little bit about triggers? Let us know what they are, et cetera.
So we're going to keep track of the time because we want to make sure that folks have an opportunity to ask questions. So this is a really, really important part. So triggers are the things that make you more likely to have a flare-up of your asthma. So common triggers are in the categories. Number one would be air-related stuff, airborne stuff. So air pollution, cold air affects some people. And people are different people have different triggers. So it's important to recognize what your triggers are, because we'll talk a little bit while about how you can control your asthma, which involves knowing your triggers and avoiding those triggers. So airborne things include cold air, bad quality of air, air pollutions, changes in quality. Some people have a problem going from cold to going from seasons. Those are all air-related things. Another thing is allergens, very, very important, often in children. Some people have allergic allergies, allergic asthma. And so outdoor allergen things are things like trees, grasses, pollen. Indoor allergen things like dust mites, and other sensitivities you can have inside the house, cats, dogs, that sort of stuff. Irritants, so things that you may do to clean your home, is a source of asthma. Most recently, we were talking about gas stoves being a factor in asthma in some families. Other eyes are infection, big one, colds, viruses. So the person will say, oh, I do fine until I get a cold. My son's like that. He has episodic asthma, about once or twice a year. He's doing fine, gets a bad cold. He has wheezing, has to use his inhaler. He says, Dad, my inhaler's expired because he hasn't used it for a couple of years. So ear infections are another big one. Exercise. Now, exercise-induced asthma is not someone getting short of breath when they exercise. Exercise-induced asthma is when you have an asthma attack that's triggered by exercise. And so thinking about that, since there are medicines that we can use to treat asthma, person use their inhaler before they exercise, because exercise is really important. So exercise-induced asthma is one thing. Emotional, and that's a big category. Everybody knows about stress, anxiety. That triggered my asthma. I need to remind everybody in the room, we all have hidden traumas we don't know about, we forgot about. And those traumas sometimes come out in asthma and other conditions. And sometimes you have to do a deep dive to figure out what those were. what I'll tell you as a brief diversion, because it's important, I've had patients that have been really, really difficult to treat and say, why can't we get this asthma under control? Why can't we get this asthma under control? And after a period of doing all the stuff you're supposed to do, which I want to elaborate on to figure out why, they're on all the drugs that are available. And ultimately we find out there's this hidden trauma that comes out. Once we find out and we address it, all of a sudden we get a breakthrough. So emotional things are really, really important. Medications, remember drugs can do anything. Complications, there's aspirin-induced asthma. Some people have nasal polyps and asthma. So that's another category of triggers. So it's really, really important to know your triggers, know your body, to be able to control the asthma so it doesn't control you. So those are some of the real big, important takeaway messages about knowing what your triggers are so you can avoid those triggers, so you can use prevention as treatment for your condition.
Thank you. And then, I'll throw a couple more your way. How would you say that allergic asthma has impacted the Black community? And are there any tips that you can recommend for us as, for patients as to how they can help to control their asthma?
So I mentioned the latter a little bit ago. Asthma is common. Asthma is very, very common. Exacerbations are probably in the top 5 reasons why kids miss school and folks don't go to work. So asthma is more common in African-American community, and we have more severe types of asthma. Now, I mentioned about asthma as a primary problem affecting your ability to function, but many of us have additional problems. We have asthma on top of diabetes, on top of XYZ diagnosis. So if your asthma flares up, that may cause a flare-up of your diabetes, or a flare-up of your COPD, or a flare-up of some other limiting factor. So this is the reason why, although asthma in itself increases death, it also increases the likelihood of flaring of other conditions that can also lead to disability and death. So this is why we want to get ahead of the asthma. And one of the biggest things I've mentioned is actually understanding your body, understanding what your triggers are, addressing them. There's some other things that have to do with keeping ahead of your asthma condition or any condition. And so I talked about the triggers. I talked about prevention as treatment. And so what I want everyone to know is that you need to understand your body. You need to understand how asthma has an effect on you. You need to sort of take control of that to some degree, to say, hey, I'm not going to do this thing because I know it may cause an asthma attack. Or I am having an asthma attack, I need to do whatever I'm supposed to do. That's part of my action plan to get this under control. I didn't say earlier, but asthma is a big topic. You know, we spend days talking about asthma. We're touching the surface. But one of the things I want to make sure you got so far is what asthma is, what the triggers are, and taking control so you can better control it and not have it control you.
Exactly, lovely. Okay, so I have one more question for you, because we really want to make sure that we give you time, because we want to hear your voice. We're doing this in service of the community, right? So I'm going to ask one more question, and then I'm going to turn the floor over to you all. So as your last question, Dr. Hawkins, I'm wondering, what would you say to an individual that may not have understandably the most trust in the healthcare system? And then if also you could just provide just a couple key points that you just reiterate to close out what you would like us to take away from this. But like trust in the healthcare system, if that is challenging, how do you handle that?
Well, that's a big question. And we spend days in symposia talking about that sort of stuff. But one thing I want folks to recognize, I think I've said, I've kind of tried to mix it in so I didn't lose it. One, you need to be educated about the condition that you have, whether it's asthma or whatever that condition is. You have an obligation to become educated about that condition. You have to empower yourself to use what you learn to help take care of yourself and the ones you care about. You have to select individuals who understand, or at least willing to learn who you are, to meet you where you are, to understand you may have limited resources that have to do with food, travel, finances, your kids, or whatever it is. And if that person doesn't understand that, if they're willing to become educated about it, then that's someone you can work with. I mean, I think that sometimes folks stay with providers. I mentioned physicians, they could be nurse practitioners, PAs. My wife's a PA. But you deserve what science has provided. I'm not going to go into treatment. I could, but there are medicines that we've made significant challenges over the last 20 years having to do with the treatment of asthma, including inhalers, steroids, drugs you can inject. But my take home of this is that take control by educating yourself and others about your condition. Tell your physician or provider what your expectations are. Tell them that you're willing to be involved in the process. You're going to do your part. You're going to help develop an action plan about when I start feeling something, I'm going to do X, Y, Z based on what we decided. I'm going to reach out to you. There'll be a growth process that allows you to be a healthier person. And you can't do it all yourself. One thing I would mention is that a lot of folks think, when we go to the office and the doctor looks at me and tells me what's going on. Medicine's not magic. Medicine's not magic. Doctors don't have a crystal ball. You have to help us by engaging and educating us, answering questions, providing information, so that we can have a well-functioning team that makes me feel that I'm doing my job, and you feel that you're doing your job, and I'm creating the best version of me from a health standpoint. Long-winded, that's it.
No, it's very important. Thank you for sharing in your own words your thought process. I found it helpful, and I'm sure a lot of us in the audience have found it helpful as well. So thank you very much. And with that, we open the floor for questions. Does anyone have any questions, comments? Very exciting. No, see, okay.
We take comments too.
Yes.
I'd like to know, what is the link between allergies and asthma? You know, a lot of the effects you have from allergies sounds a lot like what you were talking about with asthma, because I have a lot of those things, but I thought it was just my allergies, hay fever. But it sounds like it might be a little more.
Right, so one of the big triggers, particularly in kids, but adults too, is allergies, and that could be a trigger of the asthma. What happens is exposure to those things, whether it's cats, dogs, pollens, grass, causes inflammation in the branches of that tree, those bronchioles, that causes swelling, excess mucus production, and causes your symptoms. So sometimes the allergies are seasonal because there's pollen certain times of year, so the person may recognize, I have more trouble this time of the year. And they're not really sure in the beginning because, well, they haven't thought about it, they haven't talked to a doctor about it, they just know they're going to use their Zyrtec, their Allegra, their nose spray, and did it. But that's part of that education and dialogue that needs to happen between you and your providers to figure out what's going on so we can treat that condition better. There are now medications for people who have allergic asthma. They're injectables that actually can block some of the mechanism that results in asthma production. So we've made strides. I haven't talked about medication because I didn't think that was the most important part. Does that help?
Yes, thank you.
Cool. Thank you very much for.
I just wanted to say that every time I go to a doctor, I don't care what doctor, who he is or what he is, and I tell him what's wrong with me, I get the same diagnosis. It's old age. Why is that?
Well, there are some conditions that we're more vulnerable to based on the aging process, arthritis and some other things. But I think that the doctor should be able to explain to you what they mean by that. And sometimes physicians cut the person off by saying, oh, it's just old age. But it may not be old age, or they may be a trigger, something contributing to that age. So I think that one of the things that I've mentioned earlier is that you have an obligation to ask the person to explain more about what's going on so that if there's something that can be done, it is done. The other thing that's really important is advocacy. So you advocate for yourself. But I think it's very, very important to have folks in the room with when you go to see your doctor, to go to the hospital. Sometimes doctors behave differently when they see there's someone else there who's not just looking at them, but they love them, they care about them. And so I would recommend all of us to have advocates, particularly when there's difficulty figuring out what's going on. I don't know if that helps, but sometimes you need a change too. You need to, right?
Hi, yes, my name is Gwendolyn Price, and my question is, okay, so I have allergies. Okay, so where I live, there's a lot of dirt. And when the people come and do the yard, and they get that blower, it's everywhere. So my question is it good to use an air purifier, and would that help me not breathe some of that dust that I can't reach?
That's a good question. There are some air purification systems, not the little one you sit on the counter that blows the air around, but those that have HEPA filters that take particles out. Of course, when you have the opportunity, you should close the window just to reduce the exposure you may get. A lot of allergy in the room, we're talking about that. So yes, HEPA filter type devices are helpful, and some of them not only take the irritants out of the air, they can tell you what days are good days or bad days that's inside your house, and that may help you with using a diary to trigger what's going on during those days. Part of that investigation. A lot of medicine is detective work. Like I said, it's not magical. You're with yourself much more than you're going to be with your physician. So I always ask folk to say, well, sometimes you need to do a diary. What you did, what you ate, where you were, what you thought were. You're not really sure, so you got to put everything then. And it seems like it's hard work. But on the other side of that, when you get something that really helps you do better because of education and detective work, you say, yes, that really was worth it. Yeah. Is that helpful?
Yes,
Good.
thank you.
Please.
Okay, I was one of those kids who, my childhood was pretty much wrecked with asthma. Constantly going to the doctors and everything. But by the time I got to college or late high school, I had grown out of it. But I say about 15 years ago, I noticed when I'm laying down, I'd wheeze more. Going up the stairs, I'd wheeze more. And the doctors basically said I had some type of like a chronic asthmatic syndrome or something of that nature. So I'm just giving albuterol and what's the equivalent of Qvar or something like that. And is that enough?
So you raise several important points, and thanks for bringing that up. One is not all asthma is the same. I mentioned my son, it's a true story, he actually does have asthma, and it is actually episodic, and it seems to only be related to infections or infections. Not everybody outgrows their asthma. Some people do. They have childhood asthma and then it goes away. The gentleman indicated his life was wrecked because he was in the ER or the hospital all the time, a real thing. And I mentioned that earlier about time missed in school, time missed on the job because of this condition which can be chronic and persistent. He also needs to be evaluated further because what he has may not be asthma, maybe something else. And so the physician needs to not assume that something that he seemed to have grown out of is back again. But he may have had some scarring and damage that occurred over the years with the aging process where you lose lung function. It may be all related to the asthma that's now worse because of the fact that he's older now and we have less lung capacity. But it could be other things. It could be heart disease mimicking asthma. It could be acid reflux when he lays down related to causing asthma. It could be postnasal drip. It could be that vent he's sleeping over the filters haven't been changed. It could be a whole host of things which requires his provider and him to go through the exercise of figuring out what's going on. But I wouldn't stop saying that it's just asthma, because it may not be. Does that help? Good.
And I think we have a question over here.
Yes, thank you for sharing all your brilliance today. I wanted to hear if you could speak to, I've led programs for years, CEO here at St. Anne's, and I have had young people talk about that they've had asthma, they've been really sick, and then they move into a different environment, and then all of a sudden it appears to go away. I've sat as an advocate with a young person and heard that things like rodents and roaches and things we don't like to talk about can actually contribute to that. But prior to hearing that, I had never heard about that. So we were trying to figure out how the improvement came about for this young person moving from an environment in the community and moving into our space. Can you speak to, is that actually true, that a place that has, you know, cockroaches can really bring about asthma? I just heard that and hadn't known if that was actually true.
It actually is a real thing, and we do allergy testings for things like that. There are proteins and other things that can trigger. I mentioned some of the common ones many of you are aware of. Dogs and cat hair and dander is a trigger. But cockroach rodents are a real thing that can trigger. This does raise a question, though, of the environment, and I talked about it in terms of climate. This may be complex with this young man, and I'm glad that he had the opportunity to move to do better. It may have been the environment in his home. It may have been the environment outside of his home, the things he can't control, like what's going on in that neighborhood. It may be the stress. I don't know. It may have been the stress that contributed, and now he's in a better environment. It may be complicated, but the answer to your specific question is yes, but there may be a deeper dive, even though we accept the fact that, hey, he's doing a lot better, and that's great, to understand what really were those triggers back then that created the problem that now he's fortunate enough to not have.
Thank you.
Did you ever find anything more about that individual beyond?
No, it was a she, but it was,
Great.
it really was, the doctors kind of looked at everything and really talked about the cockroaches in the environment where she
Yeah.
came from, along with some other situations that she had no control over because she was an adolescent who ended up being in foster care. So I just want people to be aware of those things that they may not even think of. You're talking about dust and all these other things, but that's something that there's a little level of control over.
Right,
Thank
so thank you for that. And I mean, so that I do a sort of an environmental scan with the patient in the house. You have curtains, what's the dust, where are the vents, are they open, all those sorts of things that may be factors. You mentioned foster care, and that may be a source of trauma as well. But again, we have an obligation to try to ask and answer whether there are other things that are going on that we can actually control. I mentioned, and this is an example of that, meeting people where they are. There are things that this child did not have control over that are having an impact on them. And sometimes you can't get there in a 5-minute visit or a 20-minute visit. You may not get there until the 10th visit when the person feels comfortable enough to even talk about it.
Yeah, those ACEs.
Thank you.
All right, and so, sir, you'll be our last question.
Okay. I think we need to think that we are all mind, body, and spirit, okay? And that's how we learn to affect our wellness. We came over here from Africa. We were more natural people, physically, as well as diet. Okay, most of what we experience in America is based on what we eat, okay? And it goes back to the idea psychologically. We came here and we, over the last 400 years, we experienced what has been said as post-traumatic slave syndrome. Well, also, when you deal with diet, we have post-traumatic slave diet. So we eat what we've been conditioned to eat over generations. Some people say that diabetes runs in the family or this disease runs in the family. No, it's the recipes and the habits. The recipes and the habits. We need to change our habits of eating, and a lot of the diseases will disappear.
Thank you for that, sir.
All right, and with that, we'd like to say thank you so much for your time. Thank you for your engagement. We really appreciate it. It's been a pleasure, and thank you.